The United States passed another terrible pandemic milestone on Friday, surpassing 700,000 deaths from COVID-19, just as the surge from the Delta variety begins to slow and provide some respite to overburdened hospitals. The United States went from 600,000 to 700,000 deaths in 12 months, owing to the variant's widespread transmission among unprotected Americans. The death toll is more than Boston's population. This milestone is particularly upsetting for public health officials and frontline medical workers because immunizations have been available to all eligible Americans for over 6 months, and the injections overwhelmingly protect against hospitalization and death. An estimated 70 million Americans who are eligible for vaccination are still unvaccinated, providing fuel for the variety. The number of persons in hospitals across the country with COVID-19 has dropped to roughly 75,000 from over 93,000 in early September. New cases are on the decline, with an average of 112,000 a day, a drop of about one-third in the last 2.5 weeks. Deaths, too, appear to be decreasing, with an average of roughly 1,900 per day compared to more than 2,000 a week earlier. More people wearing masks and getting vaccinated have been credited with lessening the summer surge. The virus may have burnt through susceptible persons and ran out of fuel in some areas, resulting in a drop in case numbers. Another breakthrough was the discovery of an experimental medication for COVID-19 patients that cut hospitalizations and mortality by half. If regulators approve it, it will be the first medication for treating COVID-19, and a crucial, simple-to-use new weapon in the pandemic's armory. All coronavirus therapies currently approved in the United States require an 4-or injection. Dr. Catherine O'Neill, the hospital's chief medical officer, said the rate of hospitalizations isn't decreasing as quickly as cases in the community because the Delta variant is affecting more young people who are otherwise healthy and are staying in the intensive care unit on ventilators for longer periods of time. Natalie Dean, an Emory University professor of biostatistics, is wary about the winter, as do many other health professionals. It's unknown if the coronavirus will follow the influenza virus's yearly pattern, with expected peaks in the winter when people gather indoors for the holidays. Because of the country's size and variety, breakouts and surges will occur in some areas, she said. Furthermore, the unpredictability of human conduct adds to the picture's complexity. When people are exposed to a risk, they take safeguards, which limits the spread of viruses. Then, as people begin to feel safer, they mingle more freely, causing a fresh wave of contagion. New cases are expected to rise again this fall, according to one influential model from the University of Washington, but vaccine protection and infection-induced immunity will keep the virus from killing as many people as it did last winter. Nonetheless, the model projects that roughly 90,000 more Americans will die by January 1, bringing the total death toll to 788,000. According to the model, over half of those deaths could be avoided if nearly everyone wore masks in public.